Today, I want to talk to you about diabetic food. And diabetic food could be a combination of two things. It could be because you have not enough blood flow going to that limb, to that food, or you also have neuropathy, or either or. And because even though diabetes affects people similarly, like it mainly alters the vessels by blocking them through time, not everybody gets everything. So big vessel disease, small vessel disease. Big vessel disease will be the circulations through your foot, through your toes, and small vessel is more neuropathy. But both may have consequences by themselves or in combination. So if you don't have enough blood to your foot, you understand that that can create a problem like gangrene. The tissues start dying. But also, if you have neuropathy, sometimes you hurt yourself and you don't feel, for instance, the wound secondary to, for instance, getting something, walking around and something went through your skin, and that something, vis-a-vis a nail or something, can create an infection. But since you don't feel anything, you don't notice it until the problem is far advanced, and if it affects especially the bone in both instances, because the bone has a very tough for us doctors to use antibiotics to penetrate the bone. It's not so simple medications. Sometimes antibiotics are not that good for that. So those two instances can lead to amputations, right? Either of a toe, two toes, or the whole foot. And if it gets severe enough, you can lose the whole leg. So not only is important, as I have here on, if you can see on the screen, ideas, tips for preventing foot ulcers. I want you to read through them. But the most important thing is you cannot avoid that if your sugar is high. And if your sugar is high, you need to take action. You need to either find a provider or a doctor that can take care of you. And we work as a team now, but you need to do something because by the time you already have gangrene or you already have an ulcer, a skin lesion, sometimes it's too late. So my talk for today is more just understanding that there are two different reasons that in combination or by themselves can give you foot ulcers or amputations, but also to remind you that the obvious, right? Control your sugars, exercise, stop smoking, that's a big one. Be careful when you're barefooted and always check your feet at night. And you can use a mirror to look at the bottom of your feet every night, especially if you have diabetes for a long time. But that's my talk for today. And remember my saying, the greatest wealth is health.